Okay, good morning, everyone. Today I'll be presenting on fiscal policy specifically, and as it particularly relates to social reproduction. I'm glad that we've already started talking about unpaid care work, which is critical in this current crisis. Some feminist economists, in fact, or a lot of them, have broadly defined the COVID crisis as really a crisis of social reproduction, which is defined by the inability of people to adequately reproduce their livelihoods. And so feminist economists have been saying for a very long time, and so this is an opportunity to remind everyone that this has been out there, that, capitalism relies on more than just the productive sector. In fact, it is the intersection between the productive and the social reproduction that is critical to our economy itself. And so the narrow conceptualization of the economy by the mainstream has been that we should really focus on the productive sector and really just the market related activities. But as we know, our economy is beyond that. And we need to sustain ourselves and we need basic necessities to be here. There's a feminist economist who once said, we need to meet people's material needs and capture their imaginations. And so this has been a critical concern for me. How do we meet people's basic needs? If I'm hungry, I'm not interested in your idea of how to dismantle capitalism as a broader construct. I'm hungry now. And so this has been, in this conversation, really what I want to emphasize the need to refocus, particularly in the global south, on basic services. A study by UNU Wider showed that, before when the pandemic began, they showed that only 6.8% of households on the continent were actually ready to be able to survive the COVID or lockdown conditions. And what does that mean, right? It means in terms of when we think about access to water, when we talk about physical space, right? Whether you live in an informal settlement or you live in a household, it talks about the ability to have income to sustain yourself during a hard lockdown, and all these other things. And so it is clear that very few people, particularly on the African continent, are able to adequately have the means to socially reproduce themselves. And so, of course, the premise of the crisis is long, and everyone here knows about neoliberalism. I will not go too much into that, but really to emphasize here that there's been a systematic undermining of the role of the state in providing these basic services. And of course, that includes public health, and austerity in particular has further eroded the ability for the state to provision these goods. And of course, as we know, financialized capitalism, we heard a lot about this yesterday, has been really interested in about profit-led, disinvestment in public goods and services. And even if they are publicly provisioned, I'll come back to this about how we price the, goods and so forth. And of course, we know that, the way economics is structured, it assumes that we'll all have employment. And thus, if we were all employed, would be able to somehow outsource some of our social reproductive work, but also would have incomes to be able to secure this. But this is not true. In many countries, there's huge unemployment. We just heard about the needs, in Thailand. And in South Africa, 7 out of 10 youth are unemployed. So critical there. And a lot of people unemployed generally. And so these are sort of the things that we have to be concerned about. We already started talking about debt in the households, and the data from the COVID pandemic is showing that women in particular on the African continent were borrowing for consumption, right? People are borrowing to basically eat. People are borrowing to be able to go to the doctor on a private level. People are borrowing to survive, and we cannot have that kind of economy. And so, of course, these things have been exacerbated by the inequalities, on race, gender, sexuality, ethnicity, caste, and class. And so I think it is very important that we don't talk about these as a general, everyone in South Africa is suffering in the same way or in any other country, but to think about the ways in which the inequalities have been exacerbated. So in South Africa, we've of course had a long crisis of social production, like many other countries. And there on the right, you see a table that shows the percentage of people living below the upper bound poverty line. So more than half of South Africa's population lives below the upper bound poverty line, with Black Africans having the highest rate or constituting the largest portion relatively. But also not only that, we know that in South Africa, the people who are the poorest are young Black women in the rural areas. And that is very important to acknowledge because of the way that spatial apartheid in South Africa has manifested. And what's spatial apartheid? It means that during the apartheid era, people, or Black people particularly, had to live in certain areas, and those were significantly underdeveloped over time. And this manifests itself in South Africa today, right? So the areas that have been historically poor continue to remain poor, and the economic activities concentrated in certain areas. And of course, the separation of the family in South Africa, where men had to work in the mines, and women had to stay home in the Bantustans and take care of children, has meant that over time, even as women enter into the working market, they still have a highest share of unemployment in our country. And this is a historical phenomena of that separation of productive, which is the men going to the mines, and reproductive work, which is undertaken in the household. And in addition to that, women, obviously, Black women did work and colored women did work during apartheid, but guess what they did? Their work was to really subsidize or help white women with their social reproductive work. So they worked as domestic workers and were underpaid. And so these trends continue today, and we have to be serious about the history in order to be able to address these issues. As Lynn says, and she's not here, she says, are we taking history seriously, right? And this is very critical. And so, of course, we've had these spatial and issues, but I want to raise another significant factor or impact on our social reproduction in South Africa, is that during the HIV and AIDS crisis, or we'll call it a crisis today, is that the government was kind of slow to react. And what does that mean? It meant that in the absence of provisioning the health and ARVs to people, they kind of externalized that care to the households. So when you look at the data in South Africa during the HIV pandemic, you'll see that a lot of people had to leave work to take care of the sickly in the household. And so that was a significant factor of our history, which is generally not looked at as deeply as it should be, because that is part of the beginnings of how social reproductive work in South Africa continues to be left to the side, and with the government really externalizing care to the household. And so, despite all these problems, we find ourselves in South Africa 2014, you can even look at 2012, with a government that insists on implementing austerity. And this is self-inflicted because South Africa is not under any IMF program. We don't have to really, our debt was not, like 100 and something % of GDP. We can talk about the issues of debt later, or whether debt to GDP is a useful measure, but I think many people have covered this already. But between 2016 and 17, what we saw is that expenditure in all the items, excluding debt, was actually very low, at 0.9%, so the increases on health, education, and so forth. But why is this low in South Africa? Is one, medical price inflation is very high. And so when you are spending for health, and even if at 1%, it means that over time you are disinvesting on the health sector. Mind you, 84% of the population uses the public healthcare system, whereas only 16 use private sector healthcare. And also, South African government spends about 4% of GDP on health, which is the same as what private sector spends on health, even though they only meet the needs of 16% of the population. And so health and education here are very critical to our social reproduction. As I've already mentioned, what happens when people cannot go to clinics and so forth, it means that the work has to be undertaken in the household, and it's seen that way. And the same with education. We've been disinvesting on education for a very long time. In fact, expenditure on students has declined by 10%, even though everybody acknowledges that education is critical. And of course, education is important to social reproduction in the long run. So we've seen some concerning statistics in South Africa. The one is that between 2019 and 2020, infant mortality rates actually increased, even though South Africa over time has systematically been reducing these statistics. And this is important because, again, like I said, this is a context of austerity. It's pre-pandemic, but you can only imagine what has happened as a result of the pandemic itself. And so they have also included under 5 mortality rate, which has also increased. In terms of education, we've lost significant amount of time for students being able to go to school. In addition, students haven't been able to access the school feeding programs. And for some children, about 9 million children impacted, this is their only meals for the day. And so lockdowns meant that they couldn't access that education one, but also the ability to be able to eat. And so these are some concerning statistics. I'm going to give this example because I had a great conversation with Sunny. As in South Africa, as you know, South Africa has a great constitution, or great in quotes, which says people have the rights to education, health, and all these things, and including public basic services. But of course, basic services in South Africa are provisioned through local government. And so what happens is National Treasury allocates some funding for local governments to be able to provision, particularly free basic services to indigent households. In South Africa, it is expected or it's predicted that there are about 10 million indigent households, but see how many are actually receiving these free basic services. Across all the areas, electricity, water, it's about 3 million, And so we are really, really underspending on the households that we've already identified as needing these services for their own social reproduction. I mean, I blame partly this problem to the user-free model. And I know, people should pay for services supposedly, but really the problem is that the assumption in South Africa has been that if municipalities or local government can generate their own revenues, right, they'll be able to provision these basic services. But in South Africa, we've got such a high unemployment, inequality and poverty that people literally cannot pay for these services. So how does a user fee model work in this context? It means that spatially in municipalities where they can't raise many taxes, yes, those will continue to be poorer, right? So the redistribution and the ability to redistribute basic services remains biased. And of course, we know, for example, that without the lack of access to water, a lot of women and girls spend a lot of time doing this, and people with disabilities in particular are disproportionately impacted. There's a lot of research in South Africa that shows, here they've argued women and girls are the bearers of water. And even for a country like South Africa, which is considered, to be on the path or emerging or developmentally oriented or going in that direction, it's not doing well. But what has happened is that despite all this, there's a continuation of the status quo. Our National Treasury is obsessed, this is the word, with attaining a surplus by 2023-24, which means massive real cuts to these basic services, to education, to health. And you ask yourself, well, I ask myself, a surplus for what? What will surplus give South Africa? Will it create employment? What really will it do? And I'm not convinced that it answers it. But generally, the public is being, moralized into believing there's no alternative, right? This is what happened after the financial crisis. We have to cut budgets because if we don't, the big bad debt is going to get us. And I know debt is bad and it's, we have to think about it seriously. But to say that in South Africa, there hasn't necessarily been a need to really cut expenditure at this level to address the debt that we currently have. And so this is where we're seeing, I won't go through all of this, but it's the same currently. With this crisis, we're being moralized into thinking we're spending too much and that's what we need to cut, without addressing what Jayati Alike said yesterday, said the big culprit is the neoliberal and neo-colonial economic structure. But what has happened in the public domain, it has become, and it's not about COVID, of course it's not COVID, it is because government spends too much. And that is how, disaffected consent is being given. I won't go through this, but to really say that on the African continent, we've seen that even when countries did have fiscal space to address some of these basic services issues, they've chosen not to use it. And in fact, even in the tax systems, they've been regressive, and whereas more could have been done. And so what I really wanted to ask, and I liked the presentation before that said continuity or change, is to say, given these statistics, are we going to see a doubling down of austerity measures and so forth? Or are we going to be seeing a doubling down of what has always been the status quo? I guess one of the questions I ask myself is whether we've prematurely removed or economic or measures to manage the pandemic. And I think this might be true in many places. But not only that, while we've removed these measures, we haven't put anything else in place. So South Africa acknowledged that we have a water problem. They rolled out water tanks to all these communities. 20,000 they budgeted for, 17,000 rolled out, and many communities still said they were in distress. But after that, it was treated like a once-off initiative. There are still communities without water. And so how have we used this particular pandemic to identify the issues and then build on broadly? And here are, 1 minute. So I think really to implement radical ideas, which I think all of us have, is that we need to really go back to basics. How do we secure social protection, which includes minimum income through social protection and other measures, access to basic services, and so forth. I think really we need to ensure that the neoliberals don't get to the social protection discussion, because what's going to happen is we're going to see huge privatization of care work. Or any other ways in which they can co-opt it into their model. I think we really need to press our governments to invest, particularly in the global south, in these universal basic access. And I think we need to return to land as a critical discussion, the redistribution of land, and we don't come free, which is why I included in fiscal policy. And so how do we think about creating non-commodified ways of existence? I think this is all our collective work to do. I don't have the answers, but also thinking of fiscal space. I know many people say we can't afford it, we don't have the money, but fiscal space, is a changing thing. It's not like this is how much you've got 20 meters of fiscal space. That is not true. We can create fiscal space by investing on social reproduction and particularly households. And as we talk about the cost of living crisis, I think these questions become even more salient. Thank you.